I'm Dr. B. Girish, MD General Medicine, diabetologist and fever specialist, currently working in Union Hospital, Vijayawada. Today we'll be talking about fevers. So fevers are types as viral and bacterial. So usually we see most of the fevers are viral fevers nowadays, and since 2 years we are just fighting with this COVID-19, followed by nowadays by Omicron. So COVID-19 is a very dangerous strain which has affected large population in the world, and there are more number of deaths also have been noted. Now I'll be speaking about COVID-19 signs and symptoms. Usually we have fever, headache, body pains, shortness of breath, and cough, occasionally with sputum or sometimes only dry cough. So when we are diagnosed with COVID-19, we have to get our RT-PCR done to know the CT values, followed by HRCT, which tells which form of lung involvement we have, whether it is mild, moderate or severe, depending upon the CT scores. So patients nowadays are treated with cocktails, remdesivir and antivirals, antibiotics and antacids. So initial treatment of COVID-19 starts off with antiviral therapies. Nowadays people are given cocktails and remdesivir treatments, and constant follow-up of the patient is very important. The patients treated with cocktail are only with mild and moderate patients. Severe patients cannot be treated with the cocktail therapy. They had to be initiated with remdesivir, which has shown good improvement nowadays. And oxygen therapy is very important in COVID-19 patients. And nowadays we are seeing Omicron. Most of the people are affected with Omicron nowadays. And the signs and symptoms are similar to the COVID-19, but there is very less lung involvement in Omicron these days. Usually patients are presented with headache, vomitings, throat pain. Some people are even presented with loose stools. So in Omicron, there is that line of treatment is usually just a symptomatic treatment. If the person is suffering from headache, we can give Dolo 650. If he is having loose stools, anti-diarrheal treatment. And if he is having cold, we'll be giving Montac-LC or antihistamines. And followed by the general fevers, we have viral fevers, bacterial fevers. In viral fevers, common viral fever is dengue nowadays, which has affected large population, and followed by malarias, scrub typhus, and typhoid fevers. In most all the fevers, a very common symptom, a very common sign we see is low platelet counts. Most of the people don't understand the importance of low platelets, and people with low platelet counts may suffer with bleeding disorders, which is very, very dangerous, which might even end up with disseminated intravascular coagulation, leading to ARDS and deaths. And malaria fevers, we have a very good line of treatment for malaria fevers, where we start off with Imal or alpha beta RT ether, which has a very good improvement with this medication, or artesunate, and followed by hydroxychloroquine treatment for at least 5 to 10 days, which has shown a good improvement in the treatment. And in dengue fevers, the line of treatment is IV fluid treatment, and we have to watch out for the dangerous signs like bleeding and petechiae on the body. And scrub typhus is a different kind of fever which is caused by a bug, and it has caused major problems in the coastal areas where people doesn't understand the problems caused by scrub typhus. And next fever is typhoid fever, where most of the fevers nowadays for typhoid fevers are caused by food or water contaminations. And later I have seen many cases of typhoid positive in COVID-19, where it is a false positive. The typhoid fever is a false positive, and it has to be treated very cautiously. People presenting with typhoid positive have to be screened for COVID-19 also. Post-COVID care is very important nowadays. People who are affected with viral pneumonia, COVID-19, they usually have fibrosis in the lungs. So post recovery of the COVID-19 consists of, actually they have to be screened for any fibrotic changes, progressing fibrosis, and shortness of breath. And physiotherapy is very important in post-COVID care. So lung physiotherapy with spirometry and breathing exercises have shown improvement in the COVID-19 recovery. And constant checking of fibrosis in the lungs, followed by use of antifibrotic drugs like nintedanib, have shown a good improvement in the COVID-19 post COVID-19 care.